Jazakallah khair.
Uh,
Where are you in? Okay.
Yes.
Okay. Assalamu alaikum, everyone. A very warm welcome to all the participants joining us tonight. It is truly an honor to host this career counseling session, which is organized by Helping Hand Youth Club in collaboration with Study at Project Shahid Mohtamma Benazir Bhutto Medical University, Larkana. Today's session is especially valuable for those medical students and young doctors who want guidance regarding international medical careers, postgraduate pathways, and professional development opportunities. Uh, I would love to, introduce our respected guest speaker today, Sir Dr. Syed Zishan Javed Hashmi, who is basically an internationally experienced and recognized anesthetist with valuable exposure in global medical training and healthcare system. Sir Hashmi has inspired many students throughout his professional journey, and tonight he will share his insights that can help shape our future career decisions. As there are some participants who are not from Pakistan and they are unable to, understand Urdu, so our this session will be proceeded in English. So without wasting time, I would now like to hand over the session to our honorable speaker, Dr. Syed Zishan Javed Hashmi. Sir, the platform is all yours. You can proceed
Uh,
now.
Assalamu alaikum. First of all, I will thank Tayyib for organizing all this stuff. My name is Dr. Zishan, and I am basically anesthetist. I graduated from Allama Iqbal Medical College, Lahore, in 2004. And I had special love for anesthesia. So just after graduation, I did my internship mainly in anesthesia, and after that, I did my fellowship training from Pakistan. And just after finishing my training, I actually came to Saudi Arabia, and since then I'm here, and I have passed through many ups and downs in my career, right from the time when I did my training, and after that, when I was exposed to system in Saudi Arabia. I was lucky to be in very good hospitals, and whatever I learned, I think it's my responsibility to reflect it back to my countrymen. And another message which I would like to start from that: the more you spread the knowledge, the more it comes back to you. So I would like you, or I would request, or I will advise all of you that if you want to like strengthen your knowledge, the best way it will be to spread it to others. Okay, and so this is the basic theme, and the best way to learn is to teach. So this is my basic message from where I will start. Majority of the people attending this session are medical students. I would be very happy if any other, like other than medicals, default you guys are medical students. So if any people other than medical student, please just drop a message so that I would like to tell them, or I would like to attend them especially. Okay, and because the problem is that unfortunately the from where we detrack ourselves, that majority of the people who join medical school, uh, they are, um, you can say that like majority of the people, they don't know about medical science, and they just happen to come in the medical science because of the peer pressure from their parents. Okay, from so even I am one of them, because my mother, late mother, Allah may give her highest rank in Jannah. She has a special in, you can say that she wanted me to be a doctor. Unfortunately, she couldn't see me working as practically as a doctor, because just after graduation, when I was doing my house job, unfortunately she died. But that's our story, that all of us has to leave this world. So this another is a message that whenever we leave this world, we should keep an impression that people remember us with good name. This is one thing. And of course, whatever we do, the intention should be that it should be beneficial to others. Okay, so this is one thing, that a number of people don't know what they are doing, and in the medical school they are just following the herd. Okay, what we say that whatever others are doing, they are uh, following others blindly. So this is another important thing that don't message is that another thing which I would like all of you to know, that don't follow others blindly, because if you don't use your own brain, because all the people who enter medical schools, they used to be the brilliant student. They are the cream of the nation. Even like some people will be saying that private medical colleges is a different ball game, but still not everyone can reach the medical school. Okay, so this is something that don't forget what you are. Numbers are not the good criteria, but actually even some people have low numbers, they happen to reach the medical college, they can still beat the others. Like I would give the example for my our that one of my class fellow, he was a businessman by profession from his family, and he just wanted to become a doctor, or he had stopped his further studies, and he was in the shop, and he joined his family business. And just after 2 years, because I was among the first session who had medical, the among the our in Pakistan who had the entry test. I was in the first session. Okay, so somehow the entry test came, and he appeared in the entry test, and he bypassed his numbers, and he had excellent performance in entry test, and he joined the medical school after 2 years of experience in a cloth shop. So why I'm telling you this thing, that in the medical college, when you reach from far flung, because not everyone is from the main major city. Majority of them, they are coming from the far flung areas, and they have a totally new world. Some people are not able to speak in British accent. Some people don't know. Now the world has changed, and actually a lot of things are available to everyone, but still the people living in DG Khan or Rajanpur don't have the same facilities as living in Karachi, in Lahore, or people living in Dadu, or far-flung area of any you can name any. So they don't have the same exposure and same facilities as in the major cities. Okay, so when they come together, a number of time they are not able to cope up the pressure. Okay, and they feel themselves left out. Okay, so please, this is a message to all my cupcakes. I'm making this word for my medical students, cupcake. So they, you are very special. You are not an ordinary people. So don't left out ever in your in your life. Okay, especially in medical college, as I told you that a number of times, if you are not able to handle the pressure, you tend to go down. Okay, so this is another important thing which I would say, that have self confidence. Never ever feel underconfident, and you don't have anything under the over the head. Okay, so you don't have horns. So no, not the people who got success, they don't have horns. So if others are able to do it, you can also do it. So this is the most important thing. Okay, use your own intelligence. Use your own intelligence. Don't like that whatever I told you today, just follow. Dr. Zishan told us, so we have to follow. No, use your own brain. Use your own intelligence. Reconfirm. Think. Okay, so this is another thing. Another the important thing is that don't follow only one. I know that some people will not agree to my point that you are focused to one career pathway, but I think there should always, because being an anesthetist, I have an instinct for backup, because a number of time we fail in one plan, so we should have at least one or two backup plans. So that should be here also, that medical college will finish. No problem. Right now, maybe even if you are in first year or you are in final year, like time will fly, and you will remember the day one when you enter the medical school, and one day you will have the graduation ceremony. Okay, so don't worry about it, but always have a backup plans. Okay, so you should pardon me for my bad handwriting. Okay, so this is another important thing. Now, what you should be doing during the medical college. I know that now because when we used to study, our system was not like you guys, and majority of medical colleges now have a modular system. Okay, so modular system is the one which is actually the one which should it's like it will make you more adaptable to the international system and more adaptable to the future like postgraduate exams which you will be studying. So still if you have some people who are not in modular system, I would still suggest you to follow the modular system at your own. And modular system, what modular system is actually, you can make your own modular system if you don't have. And usually I know that some of the people who are attending this session, they are graduates or like they are. So stay tuned because the same study pathway which I will suggest you it will be helping you even if you are appearing in any postgraduate exam. Even if you are studying for your fellowship training, during your fellowship training, actually the approach should be the same. Don't forget to correlate basics and clinical. Okay. Unfortunately, in our medical system, at least when I studied, our system was pathetic. We used to, I remember the question, describe in detail control of breathing. Just imagine. I cannot forget this question. Physiology question, 25 marks, start from the A and finish at Z without any critical thinking. You are just trying to reproduce whatever you know about control of breathing. Okay, but I am 100% sure the question does not come like this now. Because why it is whosoever is writing on the screen, I request you please don't do it. I don't know who is putting this. Anyways, so this is another important thing, that try to correlate your studies. Okay, if you are studying, if you are in happen to listen to me when you are in third year and you are reading, for example, pharmacology. Okay, don't read any chapter of pharmacology without reviewing physiology. Okay, so revise the concepts of physiology when you are studying pharmacology. Revise the concepts of anatomy when you are studying pharmacology. So what will happen, that you will build up a very good base. Okay, so if you are in, for example, studying pathology, again the same thing, that pharmacology or pathology or physiology should be top up with the, you know, what can we do for it? This is distraction. Who's anyone can help me how to, who is writing on the screen? Please don't do it. And I don't know how to remove this. I'm really sorry. I don't have no idea. Anyways, so what I was saying, that whenever you are studying, try to correlate physiology, pharmacology, anatomy, pathophysiology, and the last will be medicine. Okay. I'm really surprised. Who is writing? Can anyone help me in how to fix this problem? Someone is writing on the screen. Uh, just a second. I think this is how. And
अस्सलाम वालेकुम डॉक्टर ज़िशान। अस्सलाम
yes,
वालेकुम। डॉक्टर साहब,
yes,
आप
doctor.
आवाज़ आ रही है मेरी?
जी जी, yes, yes, I can hear you.
जी 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 जी, मैं डॉक्टर सबीना बात कर रही हूँ। या आप इसको क्लिक करें ना तो राइट साइड पे आपको रेजर का निशान नजर आएगा।
Okay.
आप
Here,
राइट साइड पे क्लिक कीजिए। हाँ जी, ये आपका ये देखिए राइट
remote.
साइड पे रेजर का निशान आएगा।
Uh, I don't know
ये
who
कोई
is
बच्चा
writing.
कर रहा है। बेटा आप सबको, यू शुड बी थैंकफुल, ही इज सच अ बिजी पर्सन, ही इज ट्राइंग टू हेल्प यू आउट।
Uh, just a second.
आप स्क्रीन को क्लिक कीजिए।
Okay, I'm sorry. Just a second. Let me. Okay, here and now.
आपको राइट साइड पे देखिए, आपको निशान आएगा पेन का।
Okay, is it this one?
इसके पास आपको यहाँ पे ना इरेजर का निशान आएगा.
Just a second, Dr. Sabina. What I will do, and I think let me make you host,
एक मिनट,
co-host.
मेरे इधर से भी चला गया. एक मिनट भाई, एक मिनट में देखो. हाँ जी, आ गया. ओ,
Just a second. No, no. I stopped the sharing. I think this will.
it it came and then it went away from my side also.
I think for a
हाँ जी,
while.
एक
And
मिनट. हाँ, चल. आप राइट साइड पे अगर क्लिक करेंगे तो आपको मैं स्क्रीनशॉट, आई सेंड यू द स्क्रीनशॉट.
okay. I think I what I am doing. I have found the culprit. I think I am removing that person for a while. I think that will help
जी प्लीज.
because Mr. This Dilip person is the one who is writing it.
सर काइंडली इनको परमानेंटली रिमूव कर दीजिए.
Okay,
इनको
okay.
ये चीज़ मेरा ख्याल है सोचनी चाहिए कि आप इतना टाइम निकाल के इतना फ्रूटफुल सेशन कर रहे हैं और यहाँ पे जो बाकी पार्टिसिपेंट्स हैं उनका टाइम भी ज़ाया हो रहा है और हमारा आपका भी ज़ाया हो रहा है डेफिनेटली.
Just a second.
डॉक्टर साहब, इफ यू डोंट माइंड, कैन यू चेक व्हाट्सएप? आई हैव सेंट यू द पिक्चर,
Just a second.
स्क्रीनशॉट कि आप कहाँ से इरेजर मिलेगा. मैं देखती हूँ अगर आपने. कैन यू मेक मी द होस्ट सो आई कैन डू इट फॉर यू?
Just a second, please. Yes, ma'am. Sorry to because I have
हाँ
no.
जी, लेकिन आई डोंट नो, इट्स नॉट वर्किंग विद मी. आई एम ट्राइंग. आप व्हाट्सएप पे देखिए, मैंने आपको स्क्रीनशॉट
Oh, okay.
भिजवाया है.
Just a second, please. I am just. Uh, Madam, I'm sorry. I did not receive the
एक
message.
मिनट.
Can you resend, please?
जी जी. ओह, आई एम सॉरी, आई सेंट इट टू समबडी एल्स. आई एम सॉरी. लेट मी सेंड इट टू यू.
This is life. When you will
नो नो,
become, this is a message for the medical students as well, that right now your life is without anyone who is interfering you like that. And after few years, when you will enter in the practical life, your life will become like that. So you just imagine the medical school time is the best time of your life. I think we are good now because that person
जी
is
डॉक्टर साहब, वी आर गुड.
okay.
वी आर गुड. आई हैव जस्ट सेंड इट इनटू द ग्रुप, यू नो, आई इन द ब्लूमिंग फ्लावर्स, द ग्रुप.
Oh, okay, okay, okay. So
ओके,
I think we are good. The culprit has been removed for a while. Okay.
जी बिल्कुल,
So
बहुत
I
शुक्रिया.
don't, yes. So I was just telling that you make your own modular system, and the best system will be that whatever, like if you, for example, I will give you this example that you want to study CVS, and even if you now you hearing me and you're in final year and you want to read about arrhythmias. So if you want to study arrhythmias, right straight away go to the myocyte, go to the uh, conducting pathway. Okay, and read about what is SA node, what is AV node, and these stuff, and how like action potential occurs. And then when you will understand this thing, then you will be able to understand the arrhythmias, that you will know how the cardiac action potential occurs, how the cardiac myocytes act, what is the conducting pathway, and then you will understand how the arrhythmias are developed, and then you will understand what are the anti-arrhythmic medications, and then you will understand the medicine. So this is how I'm giving, this is one example. The same is true. You come down from from the symptomatology and go back to the very basic. Then you will be able to understand and make this apply this thing to everything you are studying, whether you are in studying physiology try to pull out some of the clinical points. Maybe you will not understand fully at that time, but with due passage of time, you will start studying. And for that, if you are studying the USMLE books, okay, the USMLE books, maybe Kaplan or BRS series or high yield series, whatever, there will be a lot of books for it, even first aid. So I will highly recommend you guys that even if you don't have any plan to do USMLE, the USMLE books will help you always. So, like you again, you can have your own style, but the concept should be like this. Okay, this is one thing. Another thing, right now it came to my mind, so I'm telling you here, there, and then. And again, this will help you, even the people who are studying for postgraduate, make notes. So notes, now because we are totally changed. Before we used to write letters. Now we send emails. Now even WhatsApp has come. So we are totally, and sometime I think somehow there will be a mechanism of putting the hand in the mobile camera and pulling it out. I don't know. Maybe it can also be there. We don't know what's with the future. So again, so now I will tell you that make my suggestion to all of you is to make audio notes rather than the written notes. Okay, because audio notes, how you can make whatever you are studying from any book, any source, read it and record it and save it in your mobile, make it a Google Drive with date wise or topic wise, and that will help you forever. That you, after 4 or 5 days, you just want to revise, open, put headphones, Bluetooth is for everyone, and now you can. So audio notes, another way it will be that when you are recording, record as a student, and when you are listening, listen as a teacher. So this will help you in increasing your listening ability, in like judging how you sound when you are recording. If there are different ways, I suggest to different people different ways. You can try what suits for you. You can record in Punjabi, you can record in Sindhi, you can record in Arabic, Persian, French, whatever, and whatever you understand. Because another thing is that sometimes we read 100 things and we are not able to reproduce even one. Okay, so instead of trying to learn 100 things, try to build up. Maybe you in first go you try to learn 10 things and you are able to reproduce them. Then add on 10, then odd, and so you don't become too much greedy. So try to build up your concepts. That maybe in one go you are not able to understand everything. So try to build up your concepts. Okay. So making audio notes, correlating the things, and from the basics to the clinical, and studying in all the way. Another important aspect which I will suggest you for studying is that sometime, even if we are trying to learn the MCQ, or like what you say BCQ, we just try to find who is the queen, and we forget the other people around. So that queen is the answer. So, and another thing, when we are there are helping books. We label them as books, and if you open those so-called books, they will never write anything like book. They will be just write as practice papers, review, and we called it as book. So book is something else. It's a review, it's a practice. So practice does not mean that you have to worship that piece of text. You just have to try to extract it, use it like a tissue paper. Don't worship that piece of paper. That is another problem which we do. That whenever we are studying from any source, I know that maybe the students who are in first year or second year MBBS, maybe they are not understanding this thing, or they are not accepting it, because again there is a peer pressure that the paper is coming from that book, and you are supposed to follow that book or notes or whatever you say. I know, but this is another part of your learning, that make yourself equipped in a way that when in the Rome, do as the Romans do. But your target should be your future. You will not have to bear with that demonstrator or that teacher forever. Respect them, say Assalamu alaikum, thank you very much, and move forward. So I know that you will have some people will be saying, oh, how can we study from USMLE books? We are following from because we used to have books like Firdaus and Shamim and BD Churasiya and so many books. Okay, and even nobody guided us that we should be studying in a clinical way. Unfortunately, this is very unfortunate, and I think you guys are lucky that your pattern is much better than us. So I remember one day we had a question: a child's nappy turns black on exposure to air. Still, I don't remember. I'm very, very bad in biochemistry. So I think that was some inborn error or metabolism. So that was the question. I don't remember exactly where it came. I think it was in biochemistry exam, something like that. We had suddenly, and we all of us were looking like an idiot. What the hell this is? Nobody. We had studied that pathway somehow, but when it came in a clinical, we don't know. Okay, you are studying the fossa and fovea and capita and upper one third and lower two third of the flana and dimgana, and you are very happy. We remember we are holding the books, sorry, we are holding the bones. So I know that you have to tolerate that pressure, but remember one thing, that when you become a clinician, the thing which you will be knowing, how to hold this hand, which are the nerve roots involving, which is this which is this tip of shoulder. So I know that it becomes difficult at times, but try, please understand that one thing will be that you will have the pressure of your teachers around you. You have to give them due respect. You have to follow the pattern, but your vision should be on the future. You will know, or you will not remain in the first year MBBS always. You will never remain in second year MBBS always. You will move forward. So use it and tolerate that and keep it as a learning. That few minutes ago we had this pressure of someone writing, and I became itchy, I became irritable, but still I have to tolerate. I cannot shut down the session and say thank you very much. I'm not able to do it. I have to face it, I have to fix it, and I have to move forward. So this is my request to all of you, that please don't bob down by anything which is coming on you. You have to face it and you have to move forward. And believe me, till the time you are alive, life will not stop. It will move forward. Okay. So this is another thing. Another important message is that if someone got any supply, no problem. I know that again, the brilliant student will not be happy at my comment, but remember, the learning is a broad spectrum thing. Okay, sometimes failure gives you so much insight that you cannot do when if you are virgin and you never faced a failure. I know that it's not true for everyone, but for some people it's true. The one standing in sitting in front of you is one of them. I was a terrible student in my postgraduate exam. I had supplies in my medical career as well, but it helped me in becoming a better clinician later on, especially the postgraduate exam. And actually, the reason why I'm talking to you without any conflict of interest, without anything, why? The reason is that because I really suffered in our system, and I cannot say sorry that I because my system is like that. So unfortunately, I cannot do anything. Yes, I was lucky, but I'm just telling you that what you say, that if you don't believe in yourself, or if you are not brave enough, or you are not able to handle the pressure, unfortunately nobody will help you in later half of your life. You have to, what you say, you have to come out, break the poster. Okay, but we say poster फाड़ के आना पड़ेगा बाहर. You have to come out with pressure. You will have to use. So mental strength is very, very important. Don't bob down with small things. Okay. So again, coming back to from like what I'm trying to build up, that how to study. These words are related to how to study, because this will help you in making your future plans. Okay, that if you are studying in an integrated, another word is integrated medicine, or what you say, integrated way of studying. Similarly, when you can integrate different subjects together: anatomy, physiology, pharmacology, pathophysiology, medicine, surgical aspects, and then some difficult subjects like psychiatry, dermatology. But remember one thing, make it simple. If you are not able to grab everything, try to have a what you say, a middle way. In Saudi Arabia, we use this word mishwar. So you try to find out a middle way in which you are able to understand something. Because if you are trying to understand everything and you are not able to do it, becomes difficult. Okay. So USMLE books will help you. You can, as I mentioned before as well, that you try to read USMLE books right from first year. You should have first aid, you should have Kaplan, you should have BRS, you should have high yield. And another thing, some people becomes worried if you have too many books. This is one school of thought that you will become confused. But tell me one thing: if you open a cupboard and we have so many dresses, like on a lighter note, the cupboard of a lady is never filled. Whenever she is opening the cupboard, even the dresses are coming down. She is never happy. She's saying, I don't have any dress to wear. What should I wear? So make this thing the same thing here, that you should have a lot of books and use them as a library. Okay, maybe you will understand some point in one book, other point in other book. As I told you, then don't worship a single book. You don't have to prove something that I read from here, from there. The end result is important. Okay, the end result is that whatever you read is on one side, and whatever you are able to express, whatever you are able to teach, whatever you are able to remember after 10 days, even after 15 days, after 20 days, even 1 month. And because if you are not able to understand this thing, no matter from where you have studied, it is useless. Okay. So another message I'm repeating again and again and again, that try to study in integrated way, USMLE books and your vision. Now coming forward, and some things which I have seen, that now there are two school of thought people, two group of people. One of them, they are saying that we have to finish USMLE in fourth year, or some of the people, they don't have any plans. They are two extremes. I know that you will be excited to appear in fourth year, but again, I will say that till the time, again, I'm telling you that this is my point of view. You can defer to it, and some people, you try to find out the way which suits you. I'm just telling you my point of view, that this is in my mind, and you can think I have a valid reason or not. Usually, if some people have not studied medicine in detail, okay, and they are trying to rush up and appear in USMLE step 1, it will not work too much, because if they have less scores, so what's the advantage? Okay. So another concept is that there is one, sorry, 100-meter race, and there is one marathon. Okay. So make yourself ready for a marathon. Okay. So if someone does not have the muscle exercise or muscle strength to have a marathon, 100-meter anyone can run. Maybe he will be on the last, but 100-meter is in your hands. And later on, when you have the muscle strength for a marathon running for 5 kilometers, okay, then you can, in 3-4 months, you can get trained for 100-meter as well. So I think, if I'm not wrong, if I'm not an athlete, but I think even the people who are training for a 100-meter race, they first build up their strength to run for 5 kilometers, and then they change themselves. They can put in 100-meter, 200, or 1 kilometer, or whatever. Okay. So my suggestion to you guys is that prepare yourself for both steps, or if you are halfway even in the second step, or especially some of the subjects which are clinical related and it will help you in step 1, try to finish them before appearing in step 1. This is my point of view. Maybe some people will agree, some people will not agree. And you can finish your both steps near final year, or just after finishing final year during the house job. You, if you prepare yourself that you are just left with 3 months to 4 months, okay, to appear in any step 1 or step 2. Okay. So this will be helping you. And another thing is that maybe after finishing your graduation, you are in a different frame of mind. Maybe especially it is especially true for females, Because, for example, if they are planning to do USMLE and they finish their USMLE, but somehow they are getting a spouse who's not having any plan to go to US. So what will you do? You will hold a gandasa and you will hold a stick that you have to go to US at any cost. No, your first priority, again, maybe I'm telling you another word here, near there and then. There is one we say always, ABC. Usually, this is the basics of everything, every study. And even for our medical resuscitation, we say A for airway, B for breathing, C for circulation. Okay. But here, I will modify this ABC for a lady. I know that some people will not agree. I will tell you, A is for Allah and Allah is for everyone. But for female, the Mijazi Allah, who is the husband. Okay. Then B is for bache, babies. And then C is carrier. Okay. So it is not your insult that someone is saying, no, you should concentrate on your family first. It does not mean that you have to leave your medical profession and you don't have to do anything. Does not mean. It means that you have been created by Allah for something. And if you will try to bypass this A and B and try to focus on C, some unfortunately it will not help you. Maybe today you are very energetic, but after 10 or 15 years you will regret. Okay, so even if you don't agree to me, please agree to me. Okay, so your focus should be on your family first, and side by side do whatever you can, because there is one thing which is called as capability and one thing what is called as capacity. Capability and capacity, these are two different things. Exceptions are always there, but usually everyone has got the same capability, but capacity may be variable. Okay, usually by default women have less capacity to handle physical, mental, psychological pressure than a man. Again, I'm saying exceptions are always there. Sometimes you can say it's a relative thought. Maybe some people have even it may be for male colleagues as well. But think about capability and capacity. You should know what are your capabilities, and what you should know what are your what is your capacity. Okay, so at the end of the day you should know what is your priority, as I told you that A comes before B and B comes before C. Don't try to bypass. Okay, so this is another important message I just wanted to share, so that you don't forget this thing, that even if you become a big doctor but you don't have a good family life, unfortunately it's not a very good thing. You should concentrate on these things. Okay, because this is one spiritual thing, is that you leave everything and you are only focusing on ibadat. This is not the real message of Islam, or this is not the real thing. Yes, you have to focus on your religious beliefs. Okay, but you never forget that you have to make a balance. You have to balance between your religious activities and your and worldly things. If you just forget about religious activities and you are only focusing on world, it's not good. And if you are only focusing on religious activity without thinking whatsoever for your present day, because you have responsibilities, you have a family to run, especially for male colleagues, they have to run a family, they will have a wife, they will have children, they will have responsibility on their parents or their family, or as a society as a whole. So don't ever forget this thing. Make your priorities clear. Okay, then now something that always plan for next 10 years rather than um, just 1 year. If you have vision on the next 10 years, that will give your plans in a better way. Like another thing, because I'm trying to answer the thing which people think and people expect. In movies, as soon as they become doctor, they become billionaire, but it never happens in life. There is a learning curve, there is a growth. Not everyone goes like this. Some people will, for example, someone go like this and then will have plateau. Okay. And if, for example, if this graph is better, okay, because this is a prospective graph. Maybe they are slow, they are taking more time, but ultimately they are achieving high goals. This is after 10 years. This is maybe after 1 year, and then after 10 years, they are wow, lag behind, or they are. So your focus should be future. Some people think that as soon as they graduate, they should earn. Yes, they should earn. But this is a message for the parents as well, and this is a message for you guys as well. You have to tell them, your parents as well, that I need some more time to get settled. And you of course, if you are sadist and you are thinking you cannot do anything, of course you cannot do anything. But we always do with a hope and a fear. This is true. You have a fear that you will not be able to do it, but you should have a hope. What we say, this is my punchline for many years: hope for the best, prepare for the worst. Okay, so this should be your punchline: hope for the best, prepare for the worst. Okay, so but don't try to rush up. Again some champion has come, so I will have to remove this gentleman as well. Vivo. Who is this Vivo? Okay, so you have to make yourself in that way: hope for the best, prepare for the worst, and spend some time, make your future plan in a way that you know that what you are doing. Plan for your future in a way that you, whatever you are doing, you know what are your goals. Okay, so usually now I focus again that what you should, step 1 preparation and FCPS part 1 preparation, almost the same. So once you are prepared for step 1, after finishing your house job, you can have FCPS part 1 and you can start your fellowship training. Okay, FCPS part 2 training. And side by side, even if you have planned to do steps, you have to pursue the career for US, you can finish your step 2, you can apply for the match. So this is residency match after step 1, step 2, and then there is a language exam. I will just try to reach shortly there, but usually you should try to focus. Step 1 and FCPS part 1 exam is almost the same, and in some part in Punjab, I think MSMD program is also there. Their exam is also like basic sciences exams is the same for FCPS part 1 and this one, step 1. So step 1 based preparation is good for FCPS part 1 for MSMD, and step 2 is almost the same like AMC, Australian Medical Council exam, like PLAB. Okay, and some Canadian exams. Okay, so like these are clinical sciences exam, and even the people who pursue for GP exams in Gulf countries, it their exam is also like that. So step 2 collaboration preparation is almost, so when you are preparing, you can aim for all these things. Another important thing which is very important for you guys to know is in language exam. So OET or IELTS. Okay, so OET is occupational English testing. This was applicable in Australia before, but now it is valid even for UK, Ireland, even for US. Because in US there used to be a CS exam. This was part of step 2, clinical skill, CK and CS. So CK means clinical skill and CK means clinical knowledge. It was do 2 steps. So during COVID time, actually they removed this clinical skill and replace it with OET. Okay. So if you are doing OET, it is valid for Australia, it is valid for America, it is valid for UK, Ireland. Okay, so IELTS requirement is a little more for UK. It is less for Ireland. IELTS is a difficult exam for people who think in Urdu and translate in English and then speak out. It is very, very difficult. Okay, so for me, IELTS was a nightmare. I couldn't perform nicely in IELTS. Anyways, so now this place I will try to cover another important because some people ask about European countries. So remember one thing, for all European countries, doors are open, but the thing is that you have to do their language first. Okay, so the language expert level, I think it is B2 level. Some people, because people ask about Norway, ask about Denmark and so many countries. Germany, I know some people who pursued their career in Germany. So basic theory will be the same. You will have to do the language exam and then you have to appear in their exam in their language. Then something will happen. So it is very difficult. I stayed whole of my life in Punjab. I'm not able to learn Punjabi despite because my mother tongue is Urdu, but I always lived in Karachi, Punjab, and I never be able to understand Punjabi even. So learning another language is, I'm not saying that you cannot do it, but it is not so easy. So I just feel vomited if I think that I have to learn German, if I have to learn French. But still, if you have aim, I'm not saying you cannot do it. You can do it, but if you have any plan to do it right now when you are in medical school, because maybe you have 10 years to swallow German language or French language or any other language. But I have very limited information about it, and I will not suggest you to leave USMLE, to leave everything and start learning German, and you don't know what's going to happen. So but the basic theory for all the European countries is their language. Only English speaking countries are England, Ireland, Australia, US, New Zealand. Maybe I'm missing something, but usually 4 or 5 countries where English language, English is a communication language. Usually in other countries, their language. Okay, and Canada I did not mention because Canadian entering in Canadian system is very difficult. Okay, even there are people who get immigration on the basis of as being a doctor. I don't know why they give immigration to such people, because maybe if I had any glimpse of getting any job in Canada, maybe 10 years ago, I would go to Canada. But I know that my sister is there, and they used to make fun that all the taxi drivers in Toronto are either engineer or doctors, a big bunch of them. Okay, so Canadian system very difficult to enter. A lot of people who try to go to Canada as a spouse, again I say that you should not leave your husband for this reason that my husband is going to Canada, thank you very much, I cannot become a doctor there, and Dr. Zishan told that you cannot go to Canada, so I will not. No, not like that, you have to follow. But usually the people who go there, they do some physician assistant, they do some paramedical stuff like echo assistant, ultrasound. There are so many things which they can do, aesthetics. There are so many things which they can do, but unfortunately, being a doctor, it's very difficult. Hardly I remember one a lady of around 50s. Somehow I found her. She got the exam, or maybe there will be some people, but I don't know. Okay, so it's very difficult to enter. Yes, US system is the best. I have a big bias for US system because remember one thing, another thing, whatever country you want to follow, you should look at the population. Okay, so population based hospitals, and then hospital based requirements, and you have to see the locals versus IMG, international medical graduates. So this is the way you should proceed rather than I like Australia. I listen from so many people that we have some bias for the political ideas of people in any country. So please, this should be the last thing to do, because if you will focus on these things, you will not be able to achieve. There is no match to US system. So I again say, and because the population of US is 350 million, 100, almost 100 to 120 million more than Pakistan. Just imagine how much will be the opportunities. And if you compare it population of whole Australia continent or whole UK will be less or will be around population of Karachi or Lahore. So just tell me where will be more opportunities. And Gulf countries, they finish before starting. I repeat, they finish before starting. Countries like Bahrain, Kuwait, Qatar, they are babies. They are less than, I think, one town of Lahore or Karachi, believe me. And they have very limited opportunities. Only Saudi Arabia, because this will be. I know that I have not seen the drop box, the chat box, but I know that there will be a lot of questions about Saudi Arabia. Even yesterday, I was talking to some of the doctor, and he became very angry when I just tried to discourage him to come to Saudi Arabia. He was not happy at my comments, but I tell you something. Another important thing you should be knowing is training. One is training and one is service job. If you are not getting a training, job is useless. A big no. People working in Saudi Arabia, majority of them working before as residents, there were a lot of opportunities because their training system was not developed. Okay, and I have seen in my stay of last 15 years, the resident positions have been squeezed totally. Majority of them gone. Still, you will find some job in a clinic. Maybe the opportunities will be very rare, but still, some people will get it. But it is not recommended because always whatever we do as a clinician or is risk versus benefit. Okay, so there are much more risks involved. You will lose your pathway. You will lose your portfolio if you are in a training program. Like people, what is the usual question? Sir, we don't have money to do USMLE. Okay, I don't refuse that anyone cannot have financial issues. But for example, if your parents have spent 100 like 1 crore 100 lakh in as medical as private, they can spend some more money on you, and they should. You should convince them. They are your parents, they are not your enemy. They tell them that if I live like this, I will have no future. Please help me. And they are your parents. If you will, even if they are not doctors, if they have brain, they will understand you. And parents, don't underestimate them. Sometimes we are not able to deliver our message. They are the best friends. In this world, there is nobody more sincere to you than your parents. Yes, their ideas can be wrong, absolutely wrong, but it does not mean that they are not sincere to you. There is no replacement of parents. But again, remember one thing, like if I give you my example, I had unlimited support from my father. Even I remember the day when I was trying to prepare for my FCPS exam, and I was not able to go because of my health issues. And I called him and I said, Abu, I want to leave the job and I just want to concentrate. Let me have one FCPS part 1 try without job, and if I fail, I will join the job. I just remember, he did not wait even more than few seconds. He said, okay, beta, do whatever you think is better for your career. Okay, I know that maybe you will not, everyone not will not get this response, but ask yourself, do you follow everything in whatever you they say? No, you try to convince them, and you have to prove them. Yes, if you commit yourself, then you will have to do out of your you have to do out of your skin. You have to work hard. There is no free cup of tea. Remember one thing, when I was stuck in my fellowship exam, I'm giving you my example so that you understand I'm not talking about aliens. I'm talking about myself sitting in front of you listening. It's an honor for me that you are listening to me. Okay. So, because like it's a big honor, but I'm telling you that I have passed through these stages. So I will suggest you guys, please don't try to rush up. I had hallucinations that I will wake up and my FCPS exam will be passed. No, I had to wait for 2.5 years till the time I like fill the gaps in my knowledge, in my performance. I couldn't pass. You know, miracles can occur. It's everything is in Allah ala kulli shay'in qadir. Allah can do, God can do anything. But usually Miracles does not happen. You have to work hard and you don't look for miracles. As a human beings, we always look for miracles. That you like the people coming to Gulf countries, they have this hallucination. They will come here, they will have pockets full of money, and then they will go to Europe. I still, you can do it. I'm not saying that you cannot do it, but I will give you an example of a very intelligent person who came with me 15 years ago, back to back. Maybe 2 months ago he came, and 2 months later I joined him. He is such an intelligent person. Unfortunately, can you believe this? I passed through that pathway. I came as a resident. Now Alhamdulillah, since 6, 7 years, I'm working as a consultant. He is in the same hospital as resident. And I feel so bad for him. He had so many plans. Or AMC, USMLE, PLAB. I feel bad for him. So many times I called him and I requested, please do it, please do it, please do it. Unfortunately, he couldn't. He had the same plans, same Sheikh Chulli plans, that he will come here and he will do everything and he will run away from here, but he couldn't. This is one example. Another example, the people who are doing training in Pakistan, they try to run away from the training, or they finish their training, they don't pass their exam and they want to leave the country. I even did the same thing, but at least I finished all the prerequisites and I was only left with my final exam. I met a person who get training. Maybe people living in Karachi know about it. Some Noor, he was a well trained. I forgot the name. He is one of the best orthopedic surgeon in Karachi, and that gentleman had done his FCPS orthopedic training, and before passing intermediate module exam, he left Pakistan and he came to Saudi Arabia as a resident with the same hope. And can you believe this? When I met him during COVID times in a very small city of Khyber in Medina, near Medina, I was shocked to listen that he was working in emergency ER resident since maybe 10 years, and he couldn't finish his FCPS. Just imagine. I felt so bad. So why I am stressing you guys, please don't even think of coming to Gulf countries without training. There is no training positions in Gulf countries. Big no. Unless somebody is putting a pistol on your head and asking you to do it, don't do it. Do your training. Again, that Pakistan had so many problems, but it is the country of our father. Even if someone is standing in the middle of the road and you are putting horn, please get me space, he will say, what is your problem? Why the hell you cannot pass from the side? This happens. Okay, because that's a country of our father. Nobody will, yes, maybe less salary, more competition, but still, you will get training anywhere in Pakistan even today. Don't tell me that you will not get a training. Yes, maybe not of your required specialty, maybe not a very good salary, maybe honorary, but you will be able to do training. Don't tell me that still you are not able to get a training. Okay, if you, maybe 1 year, 6 months, you will get a training. So your first aim should be training position. Don't leave your country. Don't leave your training. So another, now, because we are getting short of time, I because I'm telling you in a typical way, because my aim is, because you will get so many information from so many people. I'm not giving you only information. I'm trying you to tell you, explaining the information. Okay. So I'm stressing again and again, the medical students, please don't follow your seniors blindly. Have you heard of the what sheeps are doing? Sheeps are following other sheep without any thinking. And if you are seeing a herd of cattle going, they don't know where the hell they are going. They are just getting a push from behind and they are going forward. Just imagine a herd of cattle crossing you on the road while going to Naran. So many times you will face this thing. A herd of cattle is coming and now they are standing. So our life is like that. Okay. So I give another example. We are like कुएं का मेंढक. There is a special frog who is roaming around, and there is a one frog which is remaining in the well, born in the well, die in the well. Unfortunately, we are like कुएं का मेंढक. We are only following blindly other people without any sense. Use your own sense, please. And the sense is that training is more important. Yes, now coming to what I am trying to tell you, that if you finish your graduation, do your exam, even if you want to go to Australia, I'm not asking you not to go, but till the time you are in Australia or you have got a job, why the hell you are wasting your time not to do a training? One in hand is better than two in bush. Finish your training there, or keep your training. The day you get some opportunity in US, UK, Ireland, whatever, you leave this country and go. But before that, why are you wasting so many people? They are you doing USMLE, they are not doing any training, and they are, unfortunately, if they don't get the match, they are in trouble. They are wasting their time. So please count, don't waste even a single day. Then another thing, people try to do MO job. What the hell this MO job? This creates a big problem for you. Future. In future, now people, if some employer is trying to get you employed, okay, they will check your profile, what is called as portfolio. Okay. So another important thing I want you to tell is a portfolio. That, for example, if you have the most precious diamond and you give it to uh, lady frog, will she become a beautiful lady? No. So portfolio is like that. Your personality, your body language, how you communicate. Do you have eye contact? Are you able to express yourself? Like the other day, I was just listening to people who got match. I just attended a session, okay, and I was really impressed. The way they were communicating, their body language was unbelievable. Okay, so make your portfolio, and portfolio is your personality, your how much any research you have done, any clinical audits you have done, any teaching experience you have for yourself, not necessarily the teaching experience which we think. This is another thing. I will just explain to you what is the teaching experience and what is the significance of it. Portfolio, make your portfolio. And portfolio, if someone is working in nights in a mo as a mo in a totally nonsense private hospital, he has no worth. If you are working in institute like Aga Khan, Shaukat Khanam, Shifa International, SIUT, or in Lahore, Hamid Latif Hospital, or National Hospital, or Doctors Hospital, there is no comparison to them between them and people who are working in an unknown medical center. I know, again I repeat, please, I'm not saying that you don't have the peer pressure. You don't have, but you have to try to find out a middle way. But your aim should be on the training. Try to find the training. Training position is the most important. Okay. So training position anywhere in Pakistan, this should be your aim. Yes, you are planning for USMLE, you are planning for PLAB, you are planning for Australian Medical Council or whatever. But your aim should be to finish your exam, and side by side immediately do the resident start the residency, and in between, because why it is important, because if you are appearing in their in job hunt with a structured training certificate, you will have more chances. Okay. Like there is a path system, it is called as reverse residency. People don't know about it. Reverse residency is, there is one pathway of US as like what you say, residency. Okay. And other pathway is fellowship. Here we in Pakistan, what we say, main we say fellowship. In other countries they also called as board. American Board of Anesthesia, Saudi Board of Anesthesia. Okay, so for our country, board is actually, we say residency board. Our we say fellowship. In other countries, they say it sub specialty. Okay, because another thing which I want you to know, that it is era of subspecialty. In our country, mainly we have general surgery, general medicine. We have subspecialties, but internationally, and medicine is totally integrated. Sorry, medicine is totally disintegrated, surgery is totally disintegrated. Maybe after a few years there will be total disintegration in all the specialties. Like if you are doing FCPS surgery is nothing. Breast endocrine, colorectal, hepatobiliary, vascular, bariatric. So I can tell you so many specialty. And anesthesia, pediatric anesthesia, obstetric anesthesia, thoracic anesthesia, ICU, perioperative medicine, transplant anesthesia, in orthopedics even, trauma orthopedics, pediatric orthopedics, the joint orthoplastic surgeon, orthoscopic surgeon, sports medicine. So this is an era of subspecialties. Okay. So what you can do that you finish your residency in Pakistan. Okay. And you have done USMLE. Okay. You will not have the resources to go to US. No problem. Finish your residency in Pakistan. Finish your FCPS training. And then you can try for fellowship. What we say a subspecialty in our country or a second fellowship in our country. In US you will say as fellowship, and same fellowship options will be there for you anywhere in the world, maybe in UK, Ireland less likely, but UK, in even some in Canada as well, some fellowships in Australia it's difficult to get, but US again will open the doors. Why there are chances in US? Because there are lot of people who are not doing fellowships after board. There are a lot of specialities in which board enough is, like in anesthesia still, the people who are doing American Board of Anesthesia, they are big guns and they don't want to do subspecialty. So a lot of fellowships are open. Similarly, after doing one fellowship, they have 2 3 options. Okay. One option is to do 3 fellowships or 4 fellowships. Okay. And then that will be counted in residency. This is one option, or it is called as board eligible. Board eligible in US. This is, I'm telling you, the US pathway. Okay. So the board eligible, and after that you will appear in the exam and you will become board certified. Okay. So in fellowship you will get a lot of a good amount of money, fair amount of money. This is one option. The other option is that you have developed the contacts, one fellowship, and then you when once you are in US, it's very easy for you to contact people, apply, and you can get a residency. Okay. So then the here the people will be saying, "Oh, sir, we have to do start from the scratch." You know, unfortunately, I'm not saying that we are not talented, but we are from a third world country. Okay, unfortunately, and all of us know how is our system, how is our training. Whatever we are doing, majority people we are doing at our own. I'm not saying that our you don't have teaching, but majority, if there will be, that person will be very lucky who is getting a good supervisor. Unfortunately, we don't have a good system. Okay. So what happens that this is the way you can do the fellowship here, and then you can enter in the residency system. And there is another option is a faculty job. So forget about this thing, but it's still there is an option. So you can go there after that. Even if someone has done FCPS in Pakistan, they can do USMLE, finish their USMLE during, and then they can go, they can in between they can do some exams like Royal College exams, and then they can try to get a job in UK or Ireland. Okay, but again I'm telling you that training positions are very difficult to get in UK. The system is that there is one option what is called as Caesar, and one option is called as CCT. Okay. Caesar is equivalence pathway, certificate of equivalence of specialty registrar, something like that. And this is the main thing, certificate of completion of specialty training. The system is that, what is the system? I will try to make you understand. Like you heard about GMC registration or IMC registration. Okay. They have journal division, just like our PMDC. Okay, we are registered as a MBBS doctor, and then we make our our specialty entered, and whatever specialty we'll do, medicine or pediatrics or whatever. So after that, we are have the license to do anesthesia. Before that, with simple MBBS, we cannot do anesthesia. Okay, so that is again journal division, same like our PMDC. And then once you finish either of them, either CCT or Caesar, only then you will be entered in the specialty division. So what's the problem? That all the exams you will hear, even medical students must have heard about MRCP, MRCS, MRCOG, MRCEM. Okay, so there are so many exams. Believe me, they are useless alone. Okay, because one thing is training and one thing is these exams. Our qualification, our FCPS or our system is different. Our qualifications are exit qualification. What do you mean by exit qualification? Exit qualification means that you finish all the prerequisites, you finish all your trainings, and after that you are eligible for the exam. And once you pass the exam, okay, thank you very much, you have the license to kill. This is called as exit qualification. Okay, the other system in UK, Ireland is training is separate, exam is separate. Training is separate, exam is separate. How this training or exam work? Caesar is equivalence pathway, that it is for the people who have done some structure training and they have finished their structure training. Now they will apply there and they will evaluate all your papers. There is a big bunch of papers you need to prepare. That's again another chapter. You can get information, specific information about it, but then they will tell you, okay, you have this deficiency, okay, work 1 year or 2 year in this specialty, and after that finish the postgraduate exam, and then we will enter you in the specialty division. Without training certificate of CCT or without Caesar, you are in general division and it is useless. Okay, yes, again it is better than coming to Saudi Arabia or coming to Gulf countries, at least, because another aspect you should be knowing, that you have to get a passport. Passport is a degree. Like I have spent my years here. Unfortunately, despite becoming stable, alhamdulillah, I am always afraid because I don't have a passport. I don't have standing in Gulf countries. So this is another big problem working in Gulf countries. We don't have passport. So another aspect is will be that priorities. If you don't get a training, at least go to your country where you are getting the passport. But still, the first priority is residency training. Okay, so this is, I will finish in 5 6 minutes and then we will take the question. I have, because there are so many things coming in my mind, I'm trying to tell you as much as possible. Okay, so training pathway, a US system I have told you. Australian system is also like that. You appear in their registration exam, and then you just try to apply for the jobs. So again I tell you that the opportunities are less in, and they are according to the population, according to the population base, it will be like that. So language exam, OET, IELTS training, concept of the Caesar and CCT. Then another word I will say about this thing, this is a training. The exam without training is just like eating sweet dish without the main course. If you are having a lot of sweet dish in front of you and you have taken without eating kadai or biryani, it's useless. So these are, you can say that these exams are not the only thing in Pakistan, because in our country, unfortunately, we don't
No,
understand these things.
no,
Whenever we see this word FRCS or MRCP, we think that it is something. No, it is
no.
nothing. Without training, it is nothing. Okay, so that's it. So just as a sum up, have confidence on yourself, plan your pathway. Don't look for short term goals. Try to plan yourself for a bigger goals. You should start your training in Pakistan after finishing your FCPS, before applying, or side by side you are applying for so many things, but there is no replacement for your training in Pakistan. So before or till the time you get them, try to have your training, and then you will have a lot of opportunities. This is the basic message which I wanted to give. So I will stop here. All thanks all of you for listening to me, and now we will try to have the question. Okay, so anyone wants to ask any question?
Sir, there are some questions in the chat box.
Okay,
I
so
am gonna
just
ask.
help me. Can
Okay,
you
okay.
highlight the pathway for Gulf countries, especially Saudi Arabia? I have explained in detail. I will share the recording to all of you, so you can listen to the recording. But bottom line, it's not recommended unless you have finished your training in Pakistan or anywhere else. What is the pathway or prerequisite to do fellowship subspecialty for US? The you just have to register as a doctor in US, that is through USMLE. USMLE is not a degree. USMLE is just a licensing exam. Okay. And then you have to make your portfolio. You have to be very confident. You have to work in a better hospital. If you have done any postgraduate exam and then you have finished your USMLE, you have experience, then you can make your CV in a way, and then you have to sell yourself in a way that you just want to get that fellowship. So there are still opportunities for you to get fellowship. Okay, so before that you have to finish the USMLE. Till the time you don't finish USMLE, this question is useless. Many years ago, I asked one of my class fellow about fellowship, and she had a session with me, and she's asked me, "How much are your scores in USMLE?" And I said, "I'm only thinking about USMLE." She just had so many hard words. You are not still married, and you are asking where you want to get your son admitted. It's like that. Finish your USMLE, and only then this question will be valid. uh, German pathway, I have told you, German language, expert level, only there. Then after that, their exam, not much people because there is need for them, but it's not so easy. I don't have exact information, but the basic pathway I'm telling you. Any European countries, you have to finish their language exam, then you have to appear in their healthcare exam, and then you will apply for the job. This is the basic system. You have to get registered in their medical council, just like we registered in PMDC. Okay, so I think there is same questions repeated. Research, yes, research is very important. Unfortunately, one of the thing which I lack in, I have a lot of achievements, but this thing is blank. So research, audit, you should know how to do it, and this is a very important part of your CV as a portfolio. Are overcrowded? Please guide about emerging specialities. Yes, this is a very good question. I will just try to answer. Doing FCPS plus preparing USMLE is the best path, best combination. Yes, I agree to this thing. Can you please tell me what is the pathway of WHO? What is WHO? World Health Organization. A few points I wanted to tell you. I just recall, so I will tell. People working in Pakistan in teaching position, they because they have in their mind that this is something out of the world. Remember one thing. One is in internationally, the teaching position is totally different from clinical position. Okay. And you should have, if you are in a basic sciences, not less than PhD. Not less than PhD is valid. Unless PhD, you are not in a safe position. So only with the PhD, maybe you will have anything, and any qualification in medical education. So these are mandatory for people who wants to use their experience, because in our country, unfortunately, whosoever pass FCPS and finish their workshop, they became a supervisor. This is the worst thing which we can have, because supervisor is like your father, like your mother, like your elder sister, but unfortunately they don't take their your responsibility. They are just here for the taka, for the photo sessions, for the cake cutting ceremonies, unfortunately. And when you are putting the paper of experience, this is a moral responsibility on both of you. Both of us are liars. If we don't finish our training and we are asking the paper to be signed, and he is the one who is our father or mother, and he is signing knowingly that he does not teach anything, both of us are a culprit. But unfortunately we cannot do change our system. We just have to bear it, and we have to do whatever we is possible for us. Yes, I'm not sure if you are talking about some positions in preventive medicine or WHO. I'm not sure about it. I don't have much idea about it. Okay. What about Russia? Oh my God. Russia. I'm really sorry. I don't have any information about Russia. Okay, let me see the questions. Session. Germany. Uh, Germany, a lot of people are asking. I have seen people who have cleared all steps but did not match in residency, and since they don't did not do FCPS, they are junior level job. So what are your opinion about it? I have explained in detail, Alia. If you are still here, asked you, all of you, whosoever is pursuing, you should do your residency here before doing anything else. Okay. Research. I will try to help you in that because I have to help myself as well. I am very bad. I lack a lot in research. There is one doctor, Dr. Afshan Khatak. She is in our group of blooming flowers, and she has an institute which in which they are having some teaching about this research. So I will refer all of you, whosoever is interested. I will share her contact info, and you can get friends. Nephrology, it's a subspecialty of medicine, and there is a lot of opportunities of nephrology in US because nephrology is a very hectic subspecialty according to the US standards. Because usually the system is there is that either you work or you relax. There are not half measures. In our country, we are never relax, and actually we are never working. Unfortunately, we are so there are no half measures there. Either you are working or you are relaxing. Unfortunately, neither we relax by peace or neither we work by peace. We are confused people, unfortunately. Okay. Matching why it's becoming less possible. It's not, it's, Dr. Christian Gogia, there is never, it's never easy, it's never difficult. Don't look at the people who fail. Look at the people who pass. You should be looking about the people who got the residency. You should not look because always the percentage is almost the same. If you follow the statistics, you will find the same thing. Believe me, always. Okay. A lot of question about Germany. So I'm telling you again that Germany. Again, I'm repeating the same words that there is no clear information about it. It's a vague information which is available. The basic theory I have told you that you have to finish the language exam, the expert level German language exam, and then you have to apply for the German medical council registration. There will be some exam of German just like if anyone doing graduation, Pakistani doing graduation out of Pakistan, what they do. Okay. Okay, so this is again a question which I told you that remember one thing, we as a Muslim are the most culprit against Islam. Okay, so there are a lot of non-Muslims listening to me. So please listen one thing that if you think like that, you will not find anywhere in the world which is good. I cannot talk too much on politics. So, Alia, I will be very happy if you can drop a message because I share my number to all of you, and all of you are welcome to contact me anytime. You can just contact me on WhatsApp. I would like to talk to you. Alia, I would be very happy. You can take my number and let me explain to you in detail because a lot of things I cannot speak right now. Okay, but remember one thing, this is not the criteria for you to have a professional training. Okay. Why audio notes we should make rather than journal notes in our registers? Because by writing things in our own way, we remember things more sharply. You are absolutely right, Tayyab. I am telling you that when you speak out, this is another level. Okay. I'm not saying that there is replacement for writing. You are absolutely right. You can make your writing note, but in a busy life, maybe as a medical student, you can do it because you have one subject. Okay. When you will reach the postgraduate level, it becomes very difficult to make notes for everything. Okay. So this is a forward seeking. You are absolutely right that when you write, you remember, but when you speak, you also recall. Okay. Rather, when you speak out, this is another level. I'm telling you that maybe when we were studying, or you have never tried it, try as my advice. You can make your notes, writing notes, even then speak out. Okay. I am on LinkedIn. You contact me on WhatsApp. I'm not a very good social media person. I don't remember my profile name, but you can contact me on WhatsApp. And Umar Tunio, you are welcome to contact me. I have put my number right upstairs here. You can see here, you can see my number here. Okay. What about US current policies? Listen, Dr. Krishan Gogia, remember one thing. These things, when you have finished your USMLE, then talk about these things. Before USMLE, don't ask these things. Number one. Number two, keep your fingers crossed. Okay. The things never remain the same. Okay. The things never remain the same. Like I will give you example of one of my class fellow. He had an accident when he was trying to apply for residency. After that, he became off scene. He couldn't get the residency. He came back. He finished his residency in Pakistan in nephrology because he has finished his USMLE. After few years, he went there. He just did one fellowship. Now he's working as as a nephrologist in US. So remember one thing: life. This is what I told you. There is one which is called as fear, and where one thing which is called as hope. Are you sure, Christian, that you will be alive tomorrow? You are not. Nobody is sure about their life, no matter what concept of religion you have. We are not sure about our lives. We are totally unpredictable. So many times, so many things happens, and you say, oh my God, what has happened? Okay, so don't worry about it. You can only, you are standing, and I ask you to lift one of your leg. You will be able to do it. Now I ask you to lift the other leg. Would you be able to do? No, you cannot. Okay, so you can do only the thing which is in your hands, which is in your side. Rest, you cannot be assured about everything. You can only your did you try you if you are putting salt and you are expecting it to become sweet, is it possible? Will it happen? Never. Okay, so you can only try. And again, that's why I'm telling you that you should have a backup plan. What we say when we are तुम नहीं तो और सही और नहीं तो और सही. Maybe if you are not understanding, so you should not have that. If I don't get that spouse, that will be the end of the world. No, life goes on. Life goes on and goes on and goes on. So that is true for everything. Okay. I have not done any research during MBBS and concepts which nahi like doing MBBS. Listen, Hira, I am 46 years old and I am afraid I don't have much experience of research. Still, I have achieved, Alhamdulillah. I'm not saying that it is the correct thing, but unfortunately, still you have the time. Okay, till you're like my message on YouTube channel and my message in my group is that spend every day of life as if it is the last day of your life. But still, hope, we try. Okay. Wajidullah, I think you did not listen to my whole of discussion. Canada, if you want to have a taxi driving, go to Canada. Or if you want to do paramedical stuff, it's very difficult to enter in Canadian system. Okay. There are same exams like MCC, like USMLE. If you want to try, you can try, but there is not much opportunities. If there were any opportunities, I would be there. Are you already mentioned concept must be clear? Yes. What do you mean by but? They're getting specialized like peds, gynae, internal medicine, derma are very difficult nowadays. Please guide about other specialty. Yes. Please. New specialty. Some of them, like one of them, specialty is rehabilitative medicine. Okay, rehab. One of my class fellow, he did US. This is he has the same pathway. He couldn't get the residency. He did rehabilitative medicine, and then he went to US. He did FCPS. He did US and finished his fellowship, and now he's working as a consultant in Saudi Arabia. Okay, so rehabilitative medicine is a good specialty. Research, in our country, unfortunately, a lot of specialties they don't have much opportunities. Genetics, virology. There are so many specialties which you can target. Remember one thing, go step by step. Okay. Subspecialties is always preferable. Subspecialties of interest clinical science research does not excite someone. So it is really important. It is really important. It is really important. And there are different aspects of research. Sometimes if you don't want to do research, you can do some audits. Audits is a little different. What is audit? Audit is that you are trying to find out a way that if you do like this will improve the clinical outcome, for example. And you did a proposal, and then they follow, and then you get the results that if you are washing hands, there will be less chances of infection. I'm just giving you an example. So audit is one of them. Okay, you can have review articles. Review articles is not the base article. There is difference between research article and review article. Research article is on one research, and review articles is uh, like apps. You can say from a lot of review research articles you write a review articles. Where I should get recording of this session, I have conducted such sessions before as well. I will share. There is my YouTube channel. This is non-monetized channel, Anesthesia Knowledge. Okay, so if you will write in Google Anesthesia Knowledge, you will find my channel. I will show it to you as well. Or I am just away with a message. Person go to USMLE, not other side. Why almost people go to USMLE, not other side? Actually, remember one thing. Why US is superpower? They are not superpower only by one aspect of their world politics. They are they are superpower because of their system. If you happen to work with an American trained person, you will feel a difference between an American trained person and anywhere, and even British trained people. There is no comparison between. I have a big bias because in Pakistan you hardly find an American trained person. At least in anesthesia, there is only one lady which I know in Lahore. She is in Children's Hospital, Dr. Saida Asif. If you go and meet her, you will be impressed. Does not mean that I am fully convinced by her, but I'm just telling you that you will feel a difference between her with her or their system. But I'm telling you they are different. So there is no comparison to the American system of training for medicals, for doctors. So if you are who wrote this message. Yes, Ghulam Hussain. When you will get married and you will ask your wife, would you like to have silver or artificial jewelry or gold or diamond? So I'm telling you, she will not take anything other than diamond. So if you are looking for diamond for everything, why you are looking for gold or silver? So there is no comparison. At least you try to go. I'm not saying that everyone should reach US or everyone will reach US. At least you try. At least you make yourself prepared for it. You have been in Saudi Arabia for a long time. Have you observed a vast change in medical culture, especially after Saudi nationalization? With FCPS, we undergrads will take about a decade to follow your track. From there, will we observe drastic changes when our time will come, or specialized doctor are somewhat? Remember one thing. Any country, they are planning for their own doctors. Okay, so maybe we are the last bunch of doctors who are established here. Okay, I don't think so in next 20 to 30 years, because right now, even because anesthesia, number one, why still you will find anesthesia people. Anesthesia is a very stressful job. I love anesthesia every day more than yesterday. I did not tell you anything about anesthesia because people will be thinking that I am selling my specialty. I still say that anesthesia, ICU, family medicine, and emergency medicine. Anesthesia, ICU, family medicine, and emergency medicine and ICU. Emergency medicine, ICU, family medicine, and anesthesia. They are the specialties which need the most of the knowledge. Why? Because we have so many different sort of people to dealing. So coming back to that, I will tell you more details about anesthesia if you want. But the still, and this is a consultant based practice. So for every theater, we need another one consultant, or maybe one consultant is covering maximum 2 rooms. So there are a lot of still requirement of in anesthesia. Okay, and it's a stressful field. So not their locals still they are not covering fully. Okay, they are doing some clean subspecialties like regional anesthesia, pain. They are coming. They are coming in a different way. So maybe it will be saturated, but some time will be taken for ICU even, because it's a stressful job. Okay, other specialty in which there are 2 3 doctors are required. I'm afraid there is no opportunities. Like, if I tell about cardiology. Okay, the cardiology which we do in Pakistan is not cardiology. It's just a paper cardiology. Real cardiology is interventional cardiology. Real cardiology is electrophysiological study in which they find, we talked about arrhythmias to start with. So the real cardiology is, they find the focus of arrhythmia and do the radio frequency ablation. They burn it. This is cardiology. Now there is this one, I forgot the name. Inna lillahi wa inna ilaihi rajiun. In which they do the congenital heart disease, by I forgot its name. So that is the real cardiology. Actually, this is subspecialty of intervention cardiology, peds cardiology, adult congenital heart disease. Okay, so unfortunately, maybe still some cardiology people will be doing a job here, but the nonsense cardiology, not the interventional cardiology. I have friend, he cannot even enter in the interventional radiology room. Okay, similarly, maybe other specialties, urology, general surgery. I'm telling you that majority of positions, they are filled by the locals. Okay, even maybe after few years there will be no opportunities for people. So as you are saying, it will be difficult. But remember one thing, still we try and try. This is in our hand. Rest is not. I am an introvert and very bad communication skill. Recently complete MBBS. Give me suggestion. Hira, I would be very happy to guide you. Okay, so a lot of things I cannot speak out here, but I have put my number. So anyone wants to have anything, I will be like, because I have dedicated myself for this cause. Okay, so I'm available to. But remember one thing: don't even repeat that you are introvert. You have to come out of it. Okay, so the first step towards fixing this problem will be that this should be the last time you have spoken to yourself even that I am an introvert. Nobody, and everyone is introvert, and everyone can pose. Maybe you don't know what is in my mind right now, and I'm speaking like anything since 1.5 years, hours, years. I'm saying since 1.5 hours, and you cannot judge me what is in my hair, what is in my heart. Okay, so when you come in practical life, you will come to know that life is not like simple. It's like jalebi. A lot of people know about jalebi. Jalebi is a critical, as a complicated sweet. So life is like jalebi. Life is not simple. So don't think that like you are today, you will always remain like that. And you have to face the life. Okay. Once our one of our leaders said, you will only get relief in the grave. Okay, so actually he's absolutely right, that if we get relief in hereafter, this is the real success. Okay, can you do difference now and the time when you arrived? Yes, the time when I arrived, Umar, for anesthesia, the things were like that: if 9 people will apply, 10 will get the job. If 9 anesthetists will apply, one free. And now if 100 people will apply, maybe few people will get. This is even in anesthesia. So what about other specialties? It's very difficult. Alia, as I mentioned to you, that you have to make your priorities. Like, I tell you something, all people are afraid from a female driver. Because why? Why? Do you know why? Because they tend to panic. Okay, panic can be done by a man as well, but there are more chances for a female to become panic. But if they control their nerves for that panic situation, they are much better driver than men, because by instinct they are more aesthetic, they are more meticulous, they are more careful usually. Again, exceptions are always there. So there is no specialty which is labeled for a woman or a man. And another thing, if you are talking about US, in US nobody will ask, or internationally nobody will ask your gender, nobody will ask your age, nobody will ask your gender, nobody will ask your age. And only you get gender discrimination in our country. Yes, there is one aspect that we are having some bad things as a woman, but I tell you something. Remember one thing, the respect which you get. Oh sir, I have a baby at home, I have to go early. You can only say this bloody nonsense explanation only in Pakistan. Believe me. Internationally, nobody will ask your, again I tell you, nobody will ask your gender. Nobody will ask your problems at home. Yes, they have a system, like, you'll be surprised. I have one doctor, she's working in Romania. I think she's wedlocked there. So she's there because of her husband. Can you believe, they have around 1 or 2 years maternity leave. 1 year, I think, or two, I forgot. That's another thing. But once she is in the hospital working, she cannot say, oh sir, I have in-laws at home, I have a small husband at home and big kids at home, so please give me, let me go. So sir, I cannot do nights, sir, I'm female, I have. This is only respect you will get in Pakistan. Okay, so don't think that this speciality is for a woman, this is speciality for a man. Yes, you ask yourself. Being a doctor, I have told you that yes, you should know your capability and capacity. But at the end of the day, anything you can do, anyone can do anything. Yes, you ask yourself. I cannot tell that this specialty is good for women and this specialty is not good for women. I cannot tell you. Somebody who has listened to my words, when I told that your first priority is home, your first priority is your husband, your second priority is your kids, and your third priority is career. So A is, after Allah, is your Mijazi Allah, your husband. B is bache, babies, and C is career. So someone must be thinking that I am doing discrimination. No, you cannot run from the nature. This nature have made you like that. So your responsibility, if you are not a good mother, if you are not a good wife, you are, I'm sorry, I'm afraid to use this word, you are a useless character in this world, because Allah has created you for that thing. After that you do whatever. You are not stopped. You take care of your respect, you take care of your dignity. You have something that you are taking care of yourself. You can do anything. It's not forbidden. Okay, but you cannot say that we are equal. Unfortunately, you have more responsibility. I tell you something, a woman, even if she is working, I can tell you her two eyes are at home. Oh, my servant is what he's doing, my babies are doing what. A man will not be like that. I am a father of 4 kids, alhamdulillah. I can never be like my wife. I tell you something, I can never be like my wife. And I have seen working ladies. That's why I tell you that they have a lot of pressure, because their priority is home. Even if they are not taking care directly, they are not cooking food, still they are taking care of everything. So this is gender discrimination by instinct. Okay. So I think, but if you ask me, yes, the specialities in which only daytime, like dermatology, like anything in which you can organize your working hours. I will tell you something. The most women, they go in gynecology, and I tell you something. This is the worst specialty. If you ask me, then one specialty is not for women is gynecology, because in gynecology you cannot control your duty hours. You cannot say, baby, don't come today. Right now, I am having a family dinner. Can you do like that? You cannot. So, what should I tell you? You can do anything, my dear. You can do anything. This is just, should have believe in yourself. You should know your limitation. You should know your capabilities. You should know your capacities. Everything will be in front of you. Okay. I have heard that research and a degree specialty. Aliza Fatima, I think you want to go to Germany. If you want to go to Germany, you follow it, and if you have the commitment, you will be entering there. There is no comparison to an earning of US and German and European country. Okay, a well-established doctor of Germany will not earn a well-established doctor of US. Okay, so I have a bias for it. I will tell you a funny story. When we go from Saudi Arabia, usually we can have the I did not work in Europe, but I visited for my international exams, which I did. Once I have 500 euro note, 500 euro. Okay, so it is not a big thing which we are working in Saudi Arabia. It's not a big thing. So what happened? Because their life goes in 5 euros and 10 euros and 15 euros and in coins. Can you believe this? One old lady, she saw a 500 euro note in my hand in a superstore. She said to me, "Gentlemen, can I excuse? Can you excuse me? Can I see this? I'm seeing 500 euro for the first time in my life." I became surprised, but when she was not lying. And when I visited a number of times, then I came to know, yes, it's in our brain. The way of, because we were ruled by Britishers for so many years. So we have this inferiority complex. We think they are something out of the world. No, they are nothing. When I visited for the first time to UK, then I realized what their system is. Their small homes. If they are moving on the top, you can listen everything on the floor, on the ground floor. Okay, so Europe is not as attractive as I have not seen America, but I can tell you that there is no I can sense and I can tell you that there is no comparison between America and Europe. Yes, Australia is different. Australia is also living condition is very good. And another thing I forgot to tell you that uh, many years ago, I checked it out, not recently, but I think if you have done USMLE, there is some way you can enter in New Zealand as well. You can check the New Zealand Medical Council, and you can send an email. I think it will be valid because I myself checked many years ago in 2014, but I couldn't do anything, unfortunately, because nobody squeezed me to do USMLE. If you ask me during your FCPS, if any exam you should do is USMLE, because that will, number one, I will tell you something that whatever you have studied in your career, if you want to have a, like you can say that you want to clean it, if you want to have all the gaps and all the deficiencies, the USMLE is the exam. The person who have done USMLE will have very clear concept. None of the exam in the world will be difficult for you if you have done USMLE. That's I can give you an assurity. Okay. Okay. So we pass the language. Again, I tell you something. You read German language if you have done it. Okay. I'm not sure what stage of career you are. I'm not saying that you cannot do it, but I'm saying to very limited people, limited opportunities. Okay. And that should not be the first to go plan. Okay, because first to go plan is something else. Okay, so I think if anyone wants to ask any other question, please let me know. Otherwise we will finish our session. Okay, eager to learn German. Okay, so Aliza, you even even that I think for my kids as well. But I'm not I can tell you that learning another language is not so easy. If you can do it now, right now, and then you should try to marry someone. Yes, I am sorry. I would like to tell one thing also for women. When you are choosing your spouse, please, if you are interested to pursue your career, please don't get married blindly. Don't be a nut. Okay? Please try to. I know that unfortunately we don't know our rights and we don't know our responsibilities. Okay? Uh, being a Muslim, it's not that you are obliged to do everything without thinking. Okay, you can inform your parents. You can tell that I want to do this. Try to find out my spouse in that way so that you can help each other. People, I've seen people getting married to engineer working in Saudi Arabia right after graduation, and they are suffering. They are doing either, there are two extremes. One extreme is that they are going to Saudi Arabia and they are living there and they are not getting any job. This is one extreme, and the other extreme is that their husband is living in Saudi Arabia and they are doing training in Saudi Pakistan. I'm totally against this thing. Husband and wife are supposed to live together. Okay, this is not like this is not the correct way. So try to get, to marry someone in which you can have your plans together. Okay. So I don't think so. It's a bad idea, Aliza, especially for you, that try to find another German loving person so that you can fight in German. Okay. So if you are able to fight in German, then it will become very easy. Best age to get married. Again, I am biased for it. You should not waste your time just after graduation, Hira. I think for you guys, for women, for lady doctors, that's the best time because again, I'm telling you, uh, a bald man, no hair on the head like me, can get a young lady even at age of 40. But that opportunity will not be for a woman. I'm sorry to you to say this thing. Some people will not agree to this thing, but it's like that. Okay. I'm not talking about this as a bias, but this is it's like that. So the everyday, and I've give you not a clear symbolism, but man is fertile even at age of 80. Okay, but usually again a miracle can occur, but usually the fertile age is limited. Okay, and because of all the inorganic food we are taking and all the toxic things around us, radiations, everything, actually the fertility is even decreased. So if you think about in that way, it's never advisable for you to waste your time just to finish your post graduation. And so many times, unfortunately, parents, again I told you that parents, they don't have bad intention, but their decisions are wrong. When a lady, a girl become a doctor, their parents, their choice is going getting high sky. They are trying to find some out of the world person. Okay, remember one thing, your respect is as a lady. Even if you are a doctor, if you are trying to think that you are out of the world, unfortunately it's not like that. Okay, that's why our people are looking for a lady doctor who will cook food at home and not do a job. I don't know how. I don't know why they do like that. Okay, so please make your priorities before you are entering in your practical life. Okay, for men it's I got married at age of 26, and now my son, alhamdulillah, is 19 years. He is in medical school. He will be in second year shortly. So I think 25 years is a very good age for getting married. If you are marrying a lady doctor, you will find of your age maybe 1 year, 2 years younger, like that. Otherwise, another advice, maybe again some people, if you are not marrying a doctor, your wife should be at least 5 years younger than you. It's better. But if you are marrying a doctor, then you will not find this combination, unfortunately. Graduation करने के बाद रेजिडेंसी कितने करते हैं आफ्टर गेटिंग एफसीपीएस ट्रेनिंग इन पाकिस्तान देन हमें स्टार्ट से रेजिडेंसी करनी पड़ेगी इन यूएस हिरा आई टेल यू समथिंग कम आउट ऑफ दिस थिंग वी आर थर्ड क्लास citizen of a third class third world country with a third class justice system. What the hell we are talking about? Unfortunately, I'm sorry to say this, we don't have any training. So even if I get at age of 50, I get a chance to do residency in US, I will say thank you very much. Please give me a chance. So throw this out of your mind. Uh, Residency in US is better than anything else. And even if you go to UK or Ireland, Australia, what do you think they will give you a red carpet. Oh, my darling Hira, daughter, you are coming. Sister, you are coming. Please come and become a big boss. No, you have to struggle over there as well. So what's the problem in doing residency in US? So throw out ego from your mind. Okay, don't close the door of learning till the last breath of yours. If you close the door of learning, that will be the time you will go down like this. Okay, go to foreign countries, not work in own country. What's reason behind that? Actually, justice system. I can speak so much on that topic. Unfortunately, I don't want to be thrown away in black dala, or still, it's not nice to do political talk. I can speak out so many things. Our system is crap. If you ask about training, we don't have any training. I have very bad words about our supervisors. All the supervisor, majority of them, they should be thrown to sea. They are they are what you say just like Nawaz Sharif and Zardari of our community. They are the one who are not letting our system grow. So they have to run away. Unfortunately, we are not in a good shape. I have heard that is a degree, especially a degree from a well-known university like AQ, are valued above other average candidates, especially when one does training from such reputed institute. And if I will tell you something. In Pakistan, the only institute where there is training is Aga Khan. Rest comes after that. Maybe Shaukat Khanam will be number two. Maybe Shifa International will be three. And patches. I'm not saying that everyone is bad, but I'm telling you, you will hardly find someone who is good, who is committed to teach you. In our country, Aga Khan is the best institute, and I would request all of you at least try to get residency, even try to get house job, even try to get some internship or observership there. Okay. And one thing I forgot to tell when I was telling you about how to pursue fellowship pathway is that you should apply for visa, you should apply for observerships, and this will open a door for you guys to get uh, fellowship there. Okay, so I think it's we should stop here, and after that, anyone who wants to ask any question and to follow your pathway to practice as you should finish your training. You should finish your training. You should become a consultant. Sorry, only then you can try. As a resident, if you come here, I'm afraid there is no opportunity. Okay. And even if I rewind, it's not possible to rewind. Okay. But if you ask me, if I rewind, I would leave Saudi Arabia immediately as soon as I get my registration in Ireland, way back in 2015. I have Irish Medical Council registration on the basis of FCPS since 2015. Unfortunately, I did not go at that time, and that was wrong decision by me. I should have left. I should have gone there. I would have got passport, and maybe after that I would have come back. Maybe. Okay, but this is a regret which I have. We should not regret, but I'm telling you, for people following, I will never ask you to come to Saudi Arabia at the early time of your career. I would ask you to go to Europe, get the passport, and then come here. Go to US. Another thing, you must be thinking that I have a bias for US. There are two, three reasons. Number one, I don't think so. There is any other country which has more opportunities for IMGs than US. Number one. Number two, there is no place in the world which has better training than US. Number two. And number three, whenever you try to do something, remember one thing. I know that we forget this thing. Any other profession is something different than medical profession. Okay, whenever you are learning, don't try to only for passing the exam. Think you should be a doctor who can treat his or her own mother is the most dear relationship in the world. You should be confident that you can treat your father, you can treat your mother, you can treat anyone other than your mother-in-law. No, I'm just kidding. Mother-in-law is a very sweet relation, especially for a man. For women, unfortunately, no. But you should be a doctor who can who can treat his own dear one. Okay, if you are not able to do that, unfortunately you are not doing justice. Why? Because you are dealing someone's mother, you are dealing someone's father. Then why you are trying to find escape? So you are trying to think something good for you, and you are trying to find something else. So this is being a Muslim, even being a gentleman. It's not nice that you like something for you and you are not considering that thing for your brother. Okay, so please try to be a doctor who confidently can say, I can treat my own mother, I can treat my own father, and whatever you will do, believe me, it will become a barakah for you. So please, I request you, medical profession is not a joke. Don't try to run for money. You know, the easiest way to earn money is becoming a prostitute or becoming a sex worker. I'm sorry to use this word, but I'm afraid there is no better explanation for it. Don't run for money, run for glory. The money will follow you. If you are trying to find something overnight, there is no free cup of tea. If you try to become then only try to get married to a political elite. That's the only way you will get something in haram way. In halal way, you cannot. Okay, so thank you very much, all of you, for listening to me. And like thank you, Tayyab, for giving me a chance. Tayyab is still there. Okay, so Tayyab, thank you very much. And in future, even if you guys have any question, I am just a
Uh,
message away,
yes, sir.
and you can share
There
my
was,
contact details. And
uh,
I will show you my YouTube channel. Okay.
sir, it was such as,
Okay, just
sir,
one
can
thing.
you listen to me?
Yes, I can listen to you. I'm just showing this last thing and then I
Sir,
will
there is
hand
one
over.
more thing, sir.
Yes, Tayyab.
Sir,
Yes, speak out. Yes, please speak out, Tayyab. I cannot hear you. Yes, Tayyab, what you want to
sir,
say? There is some interruption, I think. I cannot hear you. Okay, so this is a playlist I will copy here right now in the chat box, in which I have done similar sessions before as well. So please copy this link right now. Take my number, and anyone who wants to have any question, especially the one who has communication skill problem, please do let me know. What books recommended for revising basic sciences for postgraduate anesthesia exam? USMLE books, my dear Rumema. I love America, American training. I love American books. I don't love America, by the way, but I love these things. And another thing, from where you studied before. That is another. USMLE books are the best. Kaplan, First Aid, U World. Okay. So yes, Tayyab, I think there is some interruption from your side. What you were saying, please speak out so that we finish. Hello. Okay, I think there is some interruption from. This was last thing I just want to tell, that there is another aspect of my life which I want to share all of you, that I have learned, just like the other things in the world. I have learned Quran. You can say, I am trying to learn Quran with reference to its language. So I would all invite all of you to just join me for that cause as well. Okay, I teach Quran Pak as well regularly every Friday and or Saturday. Okay, so those who receive the link for that, are also requested to join me for that. Anyways, thank you very much. I think there is some problem from side of Tayyab. So I will stop here. Thanks a lot, all of you. And inshallah, we will meet again. Bye bye. Yes, Umema, you were saying there are some books in the basic sciences that is for anesthesia. But I'm telling you generally that the best source for your revision, on a lighter note, in anesthesia books, thyroid gland is in the neck and secreting thyroid hormones. So even if you will open the USMLE book, you will find thyroid hormone not in the abdomen and secreting aldosterone. It will secrete the same thing in the same place. So don't worry, study from the basic sciences books, the very basics and the USMLE books. Okay. So thank you very much. Bye bye. Assalamu alaikum.